Welcome to this in-depth session on jaundice. This video will answer all your questions from what causes jaundice to how you can treat it naturally, manage your diet and even explore Ayurvedic remedies. So grab a notebook and let's get started with an engaging and educational journey about jaundice. Okay? So let's start with the causes of jaundice in adults. The most common causes involve the liver such as hepatitis or cirrhosis. When the liver cannot process bilirubin properly, it accumulates in the blood. Other causes include bile duct blockage, where gallstones or tumors obstruct the flow of bile. In some cases, excessive breakdown of red blood cells, called hemolysis, or even certain medications can lead to jaundice. Understanding the causes is crucial for effective treatment. Jaundice during pregnancy can result from several complex factors that affect the liver or bile metabolism. Let's break down for better understanding. The first and most common cause is intrahepatic cholestasis of pregnancy, ICP. This condition arises in the third trimester due to hormonal changes that impair the bile flow. When bile acids accumulate in the liver and enter the bloodstream, they interfere with bilirubin metabolism, leading to jaundice. Another significant cause is HELLP syndrome, a severe complications of preeclampsia. The term HELLP stands for hemolysis, elevated liver enzymes, and low platelets. This condition develops due to placental dysfunction and high blood pressure, which causes liver damage and impair the bilirubin processing. We also have acute fatty liver of pregnancy or AFLP, a rare but serious condition which is caused by the accumulation of fatty acids in the liver. This condition is typically genetic and occurs in the third trimester, often requiring immediate medical intervention to prevent the complications. Hyperemesis gravidarum, characterized by excessive vomiting during the pregnancy, is another potential cause. The prolonged dehydration and strain on the liver can lead to increased bilirubin production, which may result in jaundice. Viral hepatitis, particularly hepatitis E, is especially concerning during pregnancy. Viral infections inflame the liver, reducing its ability to produce or process the bilirubin efficiently. Pregnant women are at higher risk of complications from this viral hepatitis. Finally, gallstones or bile duct obstruction can also cause jaundice during the pregnancy. Hormonal changes during pregnancy slow the bile movement, increasing the risk of gallstone formation or bile duct blockage. These issues obstruct the flow of bile, resulting in the accumulation of bilirubin. Newborn jaundice is very common, particularly in premature babies. The most obvious symptom is yellowing of the skin and eyes, which usually starts a day or two after the birth. But parents should also watch for feeding issues or unusual drowsiness. If the jaundice becomes more severe, the baby might cry excessively or show stiffness in their body. In such cases, medical attention is critical. Early signs of jaundice in adults include yellowing of the skin and eyes, dark urine, and pale stools. You may also experience fatigue or itching. If you notice these symptoms, consult a doctor immediately. Bilirubin is a yellow pigment formed when red blood cells break down. Normally, the liver processes it and eliminates it through the bile. But when bilirubin levels exceeds 1.2 mg per dl, it indicates an issue with the liver, bile ducts, and also blood cells. This leads to jaundice. Jaundice is a symptom, while hepatitis is an inflammation of the liver. Hepatitis is often caused by infections like hepatitis A, B, or C, or by alcohol abuse. While hepatitis can lead to jaundice, not all jaundice cases are due to hepatitis. Certain foods can worsen jaundice by overloading your liver. Avoid fried snacks, sugary desserts, and packaged foods, as they can be difficult to process. And of course, alcohol is strictly off limits. Stick to the simple, wholesome meals that support your recovery. Traditional Ayurvedic remedies like amla juice or turmeric milk are excellent for supporting liver health. Neem leaves and sugarcane juice also promote bile secretion and aid in recovery. However, these sound complement, not replace medical treatment. Now let's talk about natural treatments for jaundice. Staying hydrated is one of the simplest yet most effective treatments. Water and fruit juice help flush out toxins. Incorporate liver friendly foods like lemon water and garlic into your diet. Avoid alcohol and greasy foods to reduce the strain on your liver. And remember, rest is essential for recovery. Now, let's look at the how jaundice is treated. So, the treatment depends entirely on the causes of jaundice. For liver functions like hepatitis, supportive care is the key for hepatitis A and E, while antivirals such as tenofovir or sofosbuvir are used for hepatitis B and C. If jaundice is caused by bile duct obstruction, procedures like ERCP or even surgery may be needed to remove the gallstones or tumors. In cases of hemolysis, the goal is to manage the underlying conditions, which could involve corticosteroids for autoimmune conditions. Drug induced jaundice typically resolves when the offending medication is stopped, but liver protective drugs like silymarin or UDCA are often used to aid the recovery. For neonatal jaundice, phototherapy is the primary treatment as it helps break down excess bilirubin in the skin. In severe cases, exchange transfusion might be required. Supportive medications like S-adenosyl methionine or SAMe or milk thistle extract help repair liver cells and improve the liver function. To complement this, IV fluids, electrolytes, and vitamin supplements are often prescribed. Lastly, lifestyle changes like avoiding alcohol, eating a liver friendly diet, and staying hydrated play a crucial role in recovery. Proper rest and following a healthy routine can significantly speed up the healing process. Let's address some common FAQs about jaundice to clarify doubts and provide additional insights. So, each jaundice a disease or a symptom? So, jaundice is not a disease, it is a symptom of an underlying condition, usually related to the liver, bile ducts, or red blood cell breakdown, which is known as hemolysis. Can jaundice spread from one person to another? No. Jaundice itself is not contagious. However, if caused by an infectious conditions like viral hepatitis, that infection can spread. What are the complications of untreated jaundice? Untreated jaundice can lead to liver failure, severe infection, or neurological damage in the newborn, known as cardiac terrace. Why does jaundice occurs in newborns? It usually due to immature liver function, which struggles to process the bilirubin efficiently. Can liver problems always lead to jaundice? No, not all liver problems result in jaundice. It only occurs when bilirubin levels build up significantly. How do I know if I have jaundice? Look for yellowing of the eyes and skin, dark urine, pale stools, and fatigue. A blood test for bilirubin confirms it. Can jaundice be cured at home? Mild cases can improve with rest, proper hydration, and liver friendly diet. But medical consultation is essential for accurate diagnosis. How long does it take to remove or recover from jaundice? Recovery time varies based on the causes, but generally it takes 2 to 6 weeks with proper treatment. What is neonatal jaundice and is it dangerous? So, neonatal jaundice is common in newborns due to immature liver function. It's typically harmless but may require phototherapy in severe cases. Does breastfeeding cause jaundice in newborns? Breastfeeding does not cause jaundice, but breast milk jaundice can occasionally occur due to certain substances in breast milk. It's usually harmless. Can alcohol worsen jaundice? Yes, alcohol can worsen jaundice as it further damages the liver and disrupt its function. What tests are done to detect liver problems causing jaundice? Blood tests like liver function test or LFTs, bilirubin levels, and imaging tests like ultrasound or CT scan are commonly used. By addressing these questions, we have tackled some of the most common concerns related to jaundice. Always remember that timely diagnosis and appropriate medical care are the key to recovery. Thank you for watching this detailed video on jaundice. If you have questions, leave them in the comments and don't forget to like, share and subscribe. Take care and stay healthy.